As we begin, I want to highlight a vital and often neglected distinction in artificial intelligence, one that becomes especially important in medicine. There are deterministic AI systems, which are task-specific machine learning algorithms designed for consistent, validated outputs. And then there are probabilistic systems, such as chatbots, which generate responses based on statistical likelihood rather than fixed rules. Today, I'll explore why this difference matters and why relying on probabilistic chatbots for medical diagnostics can lead to serious risks. Our goal is to understand not just how these systems operate, but why usually correct is not safe enough in healthcare. In artificial intelligence, deterministic systems and probabilistic systems function in fundamentally different ways. Deterministic AI, like algorithms used in imaging analysis or drug interaction checks, follows strict, predefined rules. When given the same input, these systems always produce the same output. They are predictable, transparent, and built for safety. Probabilistic AI, which includes chatbots and large language models, works differently. Instead of following fixed rules, it generates predictions based on what it calculates to be statistically most probable, learned from patterns in vast amounts of text data. This difference might seem abstract, but in medical contexts, it has enormous implications. Deterministic, task-specific machine learning algorithms behave consistently and can be thoroughly tested. For example, a deterministic system used in radiology to detect a nodule on a CT scan will produce the same result every time the same scan is analyzed. These systems are designed to be auditable. They follow explicit, traceable logic. Clinicians can validate them, regulators can certify them, and their performance and errors can be measured objectively. Their reliability makes them suitable for high-stakes environments where unpredictable behavior cannot be tolerated. Probabilistic AI, such as chatbots, operates on a completely different principle. These systems do not follow medical rules, pathophysiology, or diagnostic frameworks. Instead, they predict the next word or phrase based on statistical patterns from their training data. The output is shaped by probability, not certainty. This means that two identical prompts can produce different responses. It also means that the system's confidence does not necessarily correlate with correctness. While this probabilistic design makes chatbots flexible and conversational, it also makes them fundamentally unreliable for tasks that demand precision. In medicine, evaluating symptoms requires generating a differential diagnosis, meaning a structured consideration of many possible conditions. Probabilistic chatbots do not perform this kind of reasoning. They do not evaluate likelihood in a clinical sense. They merely generate the statistically most common response seen in similar language contexts. This leads them to overemphasize common conditions and underrepresent rare but dangerous ones. As a result, when a chatbot provides an answer to a medical question, it offers a probability-driven guess, not a clinically validated assessment. In a diagnostic setting, this guesswork can be dangerous. Take a simple scenario. A patient presents with persistent cough and chest pain. A probabilistic chatbot will often respond with pneumonia because in its training data, that association appears more frequently. But clinically, these symptoms could also indicate pulmonary embolism, lung cancer, tuberculosis, heart failure, or even non-respiratory causes. A human clinician understands that the most common diagnosis is not always the most urgent or the most dangerous. A probabilistic model, however, collapses this complexity into a single output. In medicine, a common diagnosis is not inherently the correct one, and certainly not always the safest. This brings us to the accuracy paradox, a well-known problem in machine learning. Imagine a data set where 95% of patients have condition A. A model that simply labels every patient as having condition A would achieve 95% accuracy, even though it fails to identify any other condition. That level of accuracy sounds impressive. 95% is high, right? But it is clinically meaningless. Probabilistic chatbots fall into similar traps because they rely on statistical patterns rather than diagnostic reasoning. High accuracy achieved through majority guessing does not make a model useful or safe in medical environments. Imagine a clinician who hears persistent cough and chest pain and automatically diagnoses pneumonia every time. They would be right most of the time, but that isn't medicine. Anyone could make that guess. It ignores the real work of clinical reasoning. This one diagnosis approach would miss serious conditions with the same symptoms. A pulmonary embolism may start with only cough and chest pain, and calling it pneumonia could delay life-saving treatment. Early lung cancer can also look similar. Repeatedly assuming pneumonia could allow the tumor to grow unnoticed. The danger isn't being wrong often, it's being usually right, in a way that hides critical exceptions. This is the accuracy paradox. Getting the majority diagnosis correct can still be unsafe if you miss the less common but dangerous possibilities. Medicine is irreducibly multimodal. Physicians evaluate many inputs at once: the patient's appearance and breathing, the sound of the cough, imaging results, ECG and oxygenation waveforms, lab values, vital signs, and the full medical history. This complex integration is what real diagnosis requires. A single, probabilistic, pattern-matched answer can't substitute for true medical judgment. When clinicians rely on probabilistic chatbots, several risks emerge. There is the danger of misdiagnosis, especially of rare or life-threatening conditions that the chatbot is statistically less likely to mention. Anchoring bias can occur, where the clinician becomes overly influenced by the chatbot's initial suggestion. Treatment can be delayed or misdirected. Patients may be falsely reassured. These consequences do not arise from malicious intent, but from the mathematical reality that probabilistic systems are not designed to reason clinically. They generate likely language, not accurate diagnoses. The key message is clear. Chatbots should support clinicians, not diagnose patients. In healthcare, where lives depend on precision, usually correct is not good enough. Thank you for spending this time exploring the vital difference between probabilistic chatbots and deterministic task-specific machine learning models in medicine. My name is Dr. Toma, and I'm an associate professor of algorithmic medicine at the New York Institute of Technology's College of Osteopathic Medicine, where I teach courses on how to design, validate, and deploy deterministic clinical models. I've also authored 2 books on this subject, and my work focuses on ensuring that AI systems used in healthcare are safe, transparent, and clinically meaningful. My core message is simple. Medicine is too important and too complex to rely on probability alone. Deterministic models can be rigorously tested, validated, and trusted. Probabilistic chatbots cannot replace clinical judgment, and to be fair, they were never designed to.